Good evening and welcome to tonight's Stride workshop. We've noticed a significant increase in demand for testing here at Positive East since lockdown restrictions were eased. And in response to that, I'm pleased to tell you that tonight I'm joined by our distinguished guest, Karen Moyer. Many of you will know her from her amazing work as sexual health advisor with Barts Health, a job which she's done with diligence and care for the past 18 years. And for the last 4 years, she's been the health advisor for HIV right across Barts Health. She's been working with people living with HIV since the 1990s and very early on worked with London East AIDS Network as one of the children and family social workers. Karen, good evening. It's great to have you with us. How are you doing today?
Hi, thanks, Greg. That was a nice introduction. Thank you.
More than well deserved. So Karen, can I ask you, you've been doing that job for a long time. What changes have you seen in HIV care in that time?
Things from the 90s have definitely moved huge strides. So we've gone from having not very much that we could offer people when they were first diagnosed, to being able to say to people, test early, get on your treatment early, get undetectable, get on with your life, have a family, go traveling, get the job that you've always wanted to do. So yeah, I mean, it's something now that is much more manageable.
So tonight then we're going to be talking about sort of the grassroots level of our service, which is sexual health, and not just HIV, but we're talking about sexual health and COVID. And I believe that you've got a presentation that you've prepared for us, Karen.
Yes, it's a bit of a whistle-stop tour. I didn't want to kind of frighten everybody by listing every sexual infection in the world that there was, but I think probably the few that I've listed are the most common infections that most people have heard of. Just to give the basics really of what they are, how they can be caught, whether they're treatable or not, and then also look at how to access appointments these days. I think a lot of people are a bit confused, like we all are. We're coming out of COVID. What does that mean? What's open? How can I get in to see somebody? So hopefully we can unpick a bit of that as well. Most of the information I'm giving is about East London services, because obviously that's where mostly we're working from. So apologies if people do live outside of these areas. Most clinics across London will have similar processes in terms of accessing appointments that I'm going to explain, but there may be slight differences.
Sure. Can I just add, if you're watching this and you're not from London's East End, please still get in touch with us and we can signpost you to the right services where you are.
Right. So, pre-COVID, in 2019 and back, most of us would be able to have walked into any London sexual health clinic and asked for a checkup, whether we had any symptoms or not. And a lot of people had regular sexual health checks every 3 months or every 6 months, or whenever they felt that there was a risk or they had developed symptoms. And in the last year to 18 months, we've all found that a lot of services closed, or were only working virtually, and that included sexual health services. So although most of the staff were still coming to work and were still working, we had to really limit the number of people we were asking to travel into the service. So we tried our best to work remotely, check if people really needed to be seen in the clinic, or whether we could send them out tests do at home, or if we could post them out antibiotics if they needed antibiotics, rather than them actually be seen in the clinic face to face. And so I guess we're now moving into that, hopefully, post-COVID phase, where restrictions are being lifted. There is more social interaction than there has been in a long time. And I'm guessing there are going to be a lot more people looking to meet up with new or different sexual partners again, and having more sexual activity and thinking about their sexual health needs. Next slide, please. Okay. So with that in mind, I thought we'd talk about a few of the more common infections that people are concerned about. And chlamydia probably is one of the most common infections in the UK, and is caused by a bacteria called Chlamydia trachomatis. It's a very easily transmitted infection that can be caught through unprotected vaginal, oral, or anal sex, and can even be passed if there's any dipping, i.e., if there's any brief penetration or touching of genitals before a condom is put on. So some people might say to me, I don't know why I've got chlamydia. We always use a condom. But there might have been some sexual touching or contact before that condom was used. And with things like chlamydia, that's a bacterial infection, that will be enough contact for the sexual infection to pass from one to another. However, it's not transmitted through kissing, the sharing of towels, or toilet seats, which always seems to be a common myth that kind of comes up periodically. This infection can affect your urethra, which is the tube that you pee through, a woman's uterus or cervix, fallopian tube, the testicles, the rectum, throat, and sometimes the eyes. But most often, there isn't any symptoms at all. And I think that's one of the probably key messages that most people will have heard of, is that chlamydia doesn't always have any symptoms. So you don't necessarily know that it's there unless you have a test. So if you're looking to have a test to check for chlamydia and you don't have any symptoms, we usually ask people to wait at least 2 weeks after any sexual contact that they might have had before they take a test. And this period is called the incubation period. And it just prevents us missing an infection that might be brewing, but too early for the test to pick up. However, obviously, if you develop symptoms in the meantime, you might find it starting to burn when you pee, or that there is a discharge which is not usual for you. Sometimes with women, they may describe some abdominal pain, or guys might come reporting some testicular pain. Then obviously we would not expect you to wait 2 weeks. We would suggest that you try and book an appointment to see a clinician much sooner. The tests for chlamydia usually involve taking a urine sample, or might be a self-taken swab if you don't have any symptoms, or if you do attend the clinic with symptoms, the doctor or nurse might take the swab for you. And those results are usually back from a lab anytime between 3 and 7 days after the test is done. But sometimes if you present to the clinic with symptoms, you might be given some antibiotics on the day that you attend, because they suspect that it might be chlamydia. And so they're going to start the treatment before the lab results have come back. Treatment usually is a course of antibiotics for a week that you have to take twice a day. And you need to complete the whole course of treatment in order to be fully treated. And usually we will ask you to avoid any sexual contact for that week till you've completed the course of treatment to reduce any reinfection risks um, and onward transmission to any sexual partners. Obviously, as a health advisor, we also ask that you inform any recent sexual partners to have a test and access treatment themselves too, because they may not have any symptoms either. Sometimes people get um, worried that if they haven't had symptoms, how do they know that the infection has gone after the treatment? And so they want to do a repeat test, and that's fine. That's possible to repeat the test, but again, we would normally ask people to wait around about 4 to 6 weeks after they've completed their treatment, and that's just so we don't pick up any of the old treated bacteria on the new test that you do, and then you think you've got chlamydia again, and actually it's a false positive from the old bacteria that it's picking up. And just to say, because bacterial infections are treatable, unfortunately, it does mean that you can get it more than once. And having had it once does not give you any future protection against getting it again. Next slide. Okay. The other kind of common bacterial infection that I think that a lot of people probably have heard of is gonorrhea. It's quite similar to chlamydia, and sometimes they're found together. So people might find that their results come back positive for gonorrhea and chlamydia. And it's caused by a bacterial infection called Neisseria gonorrhea. Like chlamydia, it's transmitted in similar ways through unprotected vaginal, oral, and anal sex, and can also affect similar parts of the body, as previously mentioned, such as the urethra, uterus, cervix, fallopian tubes, testicles, rectum, throat, and sometimes the eye. It's quite common for people to attend clinic with an unusual yellow or greeny discharge from the urethra, which men might notice when they pee. Um, but also, like chlamydia, you may have no symptoms at all. So again, uh, just because you have no symptoms does not necessarily mean you haven't acquired an infection unless you do a test. So the incubation period for gonorrhea is similar to chlamydia. There's also 2 weeks after a sexual contact. However, again, obviously, if you're developing symptoms which you know are not normal for you, or you're in pain, you should attend to see a clinician much sooner. It's the same sampling to do a test. So if you're a guy, the urine sample that you give us is tested for both gonorrhea and chlamydia, or sometimes women are asked to do self-taken swabs, or guys may be asked to do their own rectal swab. But again, if you're attending the clinic and you've got symptoms, it may just be that the doctor or nurse seeing you does the swabs while they're examining you. Just want to add here, the umbrellas or the knitting needles that people have heard of that we stick down your penis do not exist. Okay, so and probably not for many a decade. So, mostly if you can give us a urine sample or do your own rectal swab or own vaginal swab, then that's usually enough sample for us to test it for gonorrhea and chlamydia. The treatment for gonorrhea has changed over the years, and that's because the bacteria has become resistant to many of the antibiotics that we've used, which means basically the antibiotics which we may have given you 5 years ago to treat gonorrhea don't work anymore. And so currently, the first line treatment in most clinics for gonorrhea is an antibiotic which is given via an injection. Again, you'll be asked to not have any sexual contact for at least a week or until your symptoms have gone, and to inform any sexual partners to get tested and treated to reduce any onward transmission or reinfection risk. A test to cure, i.e. a repeat test after you've had treatment, may be suggested 2 weeks after your treatment to check that our antibiotics have been successful. This varies from clinic to clinic, depending on local policy uh, and whether people are encouraged to come back to clinic or maybe request a home test kit to do their testing. And like chlamydia, gonorrhea can also be caught more than once and be present in more than one place at one time. So, for example, you may find that you have gonorrhea both in your urethra and maybe your throat, or in your urethra and your rectum, depending on what sexual contact that you've had. Thank you. Next slide. Right. Syphilis. Okay. Syphilis is the one that confuses a lot of people, including staff, because it takes a while to get your head around it. Syphilis is caused by a bacterium called Treponema pallidum, and behaves similarly to gonorrhea and chlamydia in that it can be transmitted through unprotected vaginal, oral, and anal sex, and also can be passed from mother to child during pregnancy, which is why all pregnant women are tested antenatally so we can get them treated for syphilis before they deliver their baby. The most common sign or symptoms of syphilis are ulcers on the genital area or in the mouth. So sores that are like fluid-filled blisters are quite common, or skin rashes, or rashes that appear on the palm of your hands or the soles of your feet, or if you're experiencing any swollen lymph glands, maybe around your neck or under your arm. But again, equally, like gonorrhea and chlamydia, you might also have come into contact with syphilis and have no symptoms at all. Testing for syphilis is through a blood test, and it can take a few weeks after a sexual contact for the infection to be picked up by the blood test. So the incubation period is variable for syphilis, and it may be that the clinic advise you to repeat the test if it's negative in 1 to 3 months' time, depending on whether you have a specific concern about syphilis. If you're found to have syphilis, it's a treatable infection, and it's treated with antibiotics, either via injections of penicillin, unless you have an allergy to penicillin, or via a 2 to 4 week course of tablet antibiotics. Again, you will be advised to have no sexual contact with anybody until your treatment course is completed or any symptoms that you have gone away. We ask you to inform any recent contacts to also go and have a test and get treatment as soon as possible to avoid any onward transmission and reinfection risks. And we know that sometimes, partners may not get tested at exactly the same day, time. And so sometimes there is a bit of an overlap when people may finish their course of treatment and the partner finishes their course of treatment. But if there is any likely or possible risk of reinfection, sometimes we will advise to be retreated. Follow-up tests are usually planned with you by the clinic that treats you, and it's most common that after 3 months and 6 months, we suggest another blood test. So check that the level of the infection has come back down to negative. And then I suppose the complicated thing about syphilis in that respect is that your screening tests for syphilis now will remain positive, even once you've been treated. And so if you decide to go to a different sexual health clinic for a test 1 year, and they are going to do a syphilis blood test, it's always a good idea to let them know, I was treated for syphilis in this year at this clinic. And then when they get your positive result back, they're not assuming it's a new infection and ready to treat you. What they should be doing if you have been treated for syphilis before is checking your levels and making sure those levels haven't gone back up. If they remain low and negative, then you don't need to do anything further. If the levels do go up again, it may be an indication that you have a reinfection of syphilis and that retreatment is necessary. Thank you. Next slide. Sorry. So that's the bacterial infection. Viral infection. Again, I guess the most common one that people may have heard of is herpes simplex virus. HSV type 1 is usually found if somebody gets cold sores, but it can get transmitted to the genital area. However, HSV2 is much more commonly found around the genital area. It usually presents as painful sores and blisters, and sometimes herpes episodes and is this syphilis or is this herpes is a discussion that the doctor or nurses may be having if you present with these symptoms. But what sets the herpes apart, I guess, is usually herpes is quite sore and quite painful, whereas the blisters that you tend to get with syphilis don't tend to be painful. It can be one, or it may be a few, or a cluster of sores. And again, you may have acquired the infection some time ago and not show any symptoms at all. If you get any of the above symptoms or it's a primary infection, it could last a few weeks and you may feel like you have flu. So, like most viral infections, it has a systemic response. So, your immune system will respond to the virus being present by sending out its antibodies and fighter cells. And so generally people might feel under the weather and like they have a viral infection. Because herpes is a viral infection, there isn't anything that we can give you to remove it. As HIV currently, once you are infected with that virus, there isn't anything we can do to remove it. However, if you have symptoms, we can give you a quarter tablet that suppresses the virus and help the symptoms to to resolve and helps your immune system to recover from that episode. If by the time that you see your clinician, the symptoms are mild or maybe they're already starting to resolve by themselves, the doctor or nurse may decide to allow your immune system to do its work without needing the introduction of any tablets from the clinic. Transmission is usually via skin to skin contact when somebody has symptoms. So genital contact should be avoided at these times. Again, it's not caught through sharing towels, uh, toilet seats, swimming pools, saunas. Um, it's, if I can explain it similarly to the cold sore, when people have cold sores, they usually avoid kissing another person while the sore is present. Once the sore is gone, then yeah, kissing's allowed again. And similarly with genital herpes, once the sores are present and until they've gone away, we would advise to avoid any skin to skin contact. However, once the sores are no longer present, then yeah, you can go back to your sexual activity again. I would say that with herpes, condom use isn't always a barrier to protect yourself. So, depending on where somebody might have herpes sores, will tell you whether a condom being used actually helps to act as a barrier against those sores or not. It may be that it's on a part of the body, it's on the upper thigh, it's around near the bottom. So, the condom isn't necessarily going to act as a barrier because your skin is going to come into contact with the other person's skin. Diagnosis of or how herpes is diagnosed is usually a combination of being examined by a clinician at the time that you have uh, the sores or symptoms by taking a swab from that sore area, uh, and then usually sending that swab to the laboratory to ask them to confirm if the virus is found. However, it's usually treated on site. So if the doctor or nurse that is examining you feels that what you're experiencing is an episode of herpes, they will give you the viral suppressant tablets to take rather than wait for your lab tests to come back. Um, and just a general note about herpes. Um, it's thought that around 70% of the adult population may have acquired the herpes simplex virus, either one or two or both, at some point in their adult life. But the vast majority of those people will never go on to have any symptoms. So we may never find out whether we have or are carrying this virus inside of us. We're probably only going to find out if we ever develop any sores, which take us off to the doctor to be examined and be advised that it's likely that it's a herpes simplex episode. Thank you. Next slide. Okay. So I guess the other most common viral infection is genital warts. And these are caused by the human papillomaviruses, of which there are many. I mean, hundreds, I think. Genital warts are caused particularly by HPV type 6 and type 11. The verrucas, which are the other type of warts that I think a lot of people have heard of, which can be caught on the hand or on the sole of but are of a different type of HPV virus. So there's no crossover between uh, verrucas and genital warts at all. Transmission is usually from sexual contact with somebody who has genital warts at the time. And so, again, skin to skin contact would be the way that it's brought from one person to another. So if you have symptoms, skin to skin contact is advised to avoid, to be avoided. However, sometimes symptoms are not always visible. They may be internal, they may be inside the vagina or inside the anus, and then somebody may not be aware that they're there until they start to experience some discomfort, um, and attend to see a clinician for examination. I guess the best way to describe them are like small lumps on the skin, which can vary in size or color. And again, are not normally painful, but can be itchy and occasionally might bleed if the lumps are damaged. Um, so it's quite common for people to come to clinic and say that the lumps have been present for weeks or sometimes months, um, and not cause them any problem, but they mention it because they're in clinic at the time. Um, Again, they are normally diagnosed by being examined by a doctor or nurse in a sexual health clinic, and treatment is usually a cream that is given to you to take home and apply at home if that's easily done. Or sometimes you may be asked to attend the clinic at regular intervals uh, for one of the doctors or nurses to freeze them for you. It is hard to say when somebody might have acquired uh, genital warts unless your current partner also is reporting symptoms, um, because the symptoms may not occur at the time that you first acquire the infection. Um, However, like I said, we normally advise you to contact the most current partner or contact just in case they report that they have symptoms. Thank you. Next slide. Hepatitis. Okay, so hepatitis A and B are common infections globally and are viral infections which can affect the liver. Some people can have hepatitis and be unwell and then go on to develop their own antibodies and immunity from the infection. Um, Others who test negative can be vaccinated against both hepatitis A and B to protect them from any future contact with these infections. And some people can be carriers of hepatitis B. So it's there. They might need regular monitoring of their liver, but actually feel perfectly well. So it's just a matter of them being followed up to check that the liver isn't being damaged in any way. The hepatitis virus is found in the blood and bodily fluids such as semen, vaginal fluids of an infected person. And if you have contact with someone who has an active viral infection, uh, then sexual contact can be a risk of transmission. And you're advised to test uh, quickly, and if negative, get vaccinated. Um, Hepatitis C is an infection more commonly uh, found among injecting drug users who perhaps share needles or works with someone else who has the hepatitis C infection. It is a bloodborne virus, so can be transmitted if your sexual activity also involves some risk of exposure to blood. Um, there is now a much more tolerable and shorter course of treatment for hepatitis C. Um, some time ago, the treatment for hepatitis C used to last a good year, sometimes more than a year, with lots of tablets that had to be taken. So this new development has meant it's been much easier to encourage people to come forward and get tested, uh, and also start treatments. And a lot of people now have been successfully treated for their hepatitis C, which obviously is good in terms of outcomes for uh, your liver function. Um, and I guess for those people living with HIV, um, these tests should be regular tests that are carried out by your clinic who look after your HIV. So on a fairly regular basis, all of these hepatitis and syphilis tests are usually amongst all of the blood tests that they carry out at the clinic visits. Thank you. Next slide. So now I've got you all worried about sexually transmitted infections and what you might have been in contact with. How do you get a sexual health check? So I guess, there are many places that you can request a test. If you have a good GP that you have a good relationship with, sometimes they will order the tests for you. Um, some pharmacies in East London have been recruited to offer uh, tests to people that don't have any symptoms. As we mentioned earlier, you can order home test kits. So you order the tests to be sent to your home, you do them at home and then send them back for testing through the post. Or you can access a sexual health checkup at one of your local sexual health clinics. And as we mentioned at the beginning of the talk, access to these services um, was much restricted during the time of the pandemic, for obvious reasons. But home test kits remained available, and I think Sexual Health London, which is the website below, saw a huge increase in the number of requested tests that they got through during that time. So if you're able and you have access to the internet, then shl.uk is the Sexual Health London website where you can register, get a test kit sent to your home or a address of your choosing, and then you do the tests at home, pop them back in the provided envelope, and then they will normally text you out the results, as I say, usually within a few days. If they pick up anything that is positive, then they're very good at identifying your nearest clinic and helping to signpost you to that clinic. Next slide. Okay. So finally, a bit of unadulterated self-promotion. If you go on to, I don't know if you can see it, sorry, I think I might have copied it quite small, but if you go on to the All East Sexual Health website, which covers all of the services that come under the umbrella of Barts Health, you can choose to access any of the listed sexual health services that we run across Tower Hamlets, Newham and Waltham Forest. There's also a direct link into the Sexual Health London website, or if you prefer, there is an option where you can book an appointment online to have a telephone consultation, or I believe a face-to-face consultation as well. So, yeah, have a look, tap in All East Sexual Health, have a look through the website. I think there is also a telephone number on there which goes through to our call centre. So if you're having trouble booking your appointment yourself online, hopefully one of the people in the call centre will be able to assist you with booking an appropriate appointment.
If I may interject very quickly, Karen, if you're
Yep.
living in the east of London, you can access full sexual health screening services through my organisation, Positive East. So just ring the switchboard and someone will be able to help you.
Yeah, sorry. Yes, great.
It's all right. It's all right.
That's true.
What's in our past? Listen, we're all doing the same job, the same service, helping the same people. So
Exactly. And I think for a lot of people, it's about what's the most convenient, what's the nearest, what's the most convenient, what's open. So, we do have clinics that are open in the evening at both Stratford and Whitechapel, and on Saturdays. But also equally, I know that there are other clinics around London that are also open at the weekends and into the evening as well.
And if you're watching this for the first time, you've not been to a sexual health screening before, it's my first one. It was a very terrifying process, but we've all been doing it a long time. Everyone I work with is all very friendly in my own organisation and within the HIV community in general. So if you got any worries, get in touch.
And I think the final slide. Yeah, I think I probably reiterated all of that. I mean, I guess it's really about starting to learn what clinics are opening back up and what their current services are. And I think that what we have learned in the sexual health clinics is that we can streamline our services better than perhaps we were doing before. So you may find that people still want to have a telephone consultation with you first to find out if it's absolutely necessary for you to come into clinic, or whether we can assist you with testing at home or accessing treatments in another way. I think very few clinics that I'm aware of, I don't know about Positive East, where you can actually walk in now and request a sexual health checkup. And this is partly because most clinics and services need to know now how many people they're expecting into their service at one time, and also to try and keep appointment times for those that actually need to be seen and to come into clinic. Just reiterating that, the website is available to help people have a look at what services are around in East London. But not everybody is comfortable with doing things online, and so I would still encourage people to try and call if there is a number for a clinic that you can get hold of, or if you need support from the guys at Positive East, or your HIV service. I know a lot of HIV clinics also are happy to run some sexual health checks when you attend for your routine appointments. So that's always an option as well. And that's me done. So thank you for listening this evening.